pleasure. I just wanted to say good evening, everybody. I'm excited to be here with all of you tonight from the sunny Toronto, Canada. Not as sunny as California, of course. But I did want to thank, both my fellow Canadian and US colleagues, for attending tonight and taking time away from your schedules to be able to hear what we have to say today. So my name is Dr. Sheikh, and the goal really for tonight is, a lot of us are getting bummed out right now, with this whole COVID thing and these protocols. And everybody, it's really, really easy to kind of get down on yourself and your practice and look at the hygiene schedule and say, wow, you know what, it's just falling apart. There's those types of dentists who look at things that way. And then there's some that see this as an opportunity. And that's what I'm here to talk about you guys tonight, about the opportunity that you have right now in a COVID situation. And that opportunity is soft tissue management, and how this can really help your practice more now than it could have ever done in the past. So I'm really excited to share, give you an overview of our soft tissue management program. Now, this is normally a full day lecture for you and your team, and it's a non-surgical approach to managing perio in your practices. So we're going to talk about, the systematic approach from diagnosing, treatment planning, performing therapy, and maintaining our patients. That's why Lauren said we have a lot to talk about today. We've got about 45 minutes up to maybe about an hour. I'm trying not to keep you guys here too long. But just shortly, Lauren did a great job just introducing myself. I've been, lecturing on the circuit in both US and Canada for several years. I do a lot of motivational speaking as well, in case presentation, in case acceptance. And most importantly, my passion has other than hygiene, which is really my base, has been implants. So I am the founder of the Ontario Dental Implant Network. I provide live surgery mentorship to over 85 dentists across Ontario, and we even have some members in Vancouver. So right across, Canada, we'd love to have some US members as well. So the website is livedentalsurgery.com, and in essence, we have meetings, we develop camaraderie. Obviously, COVID's put a bit of a damper on that, but we have an amazing group chat where you can, learn and also the opportunity to observe surgery, both live and on video, just to help improve, everybody's skills. So I'm really passionate about that, as I am, hygiene. And if anybody's ever interested, you're always welcome to reach out to myself. So we have, a wonderful program throughout the year with different courses and programs to be able to help allow you to excel. We also give, exclusive member discounts. So just really cool things that we've been able to do and develop an amazing network of getting close to over 100 dentists. And I think it's important to have that camaraderie now more than ever, being in an isolated kind of situation that we are. So a disclosure, of course, the CE course is sponsored by DenMat. I've been lecturing for them for, God, must be around 9 years plus. So again, I'm excited, and I wanted to thank them for having me back again. So before we get into soft tissue management and what that is, I want you really to think long and hard about this question. Are you treating your patients? So of course, we see our patients, they come in, we provide a treatment, they leave. But at the end of the day, are our patients improving? If you look at the definition of treatment of disease, it talks about the science and art dealing with the maintenance of health, the prevention, alleviation, and cure of that disease. So if you look at a patient who has perio and they come into your practice, when they leave, or after several sessions, when they leave, are you maintaining health, or are you just performing what I like to call supervised neglect? So the patient just keeps coming back, and there's bleeding and there's pockets, and maybe in your practice it's a 6-7 millimeter pocket before they get treatment. We're hoping that after today, you're going to realize that any form of bleeding or deep pocketing needs to be treated because it is a sign of disease. Now, further down that list is the branch of medicine. It talks about the branch of medicine concerned with the non-surgical treatment of disease. And this is exactly what we want for our patients. We want to be able to treat them non-surgically, have them improve, and be stable. And that's really what the goal of a proper perio program should be in every single practice. So when we survey our dentists who attend our courses, typically we find that most of the doctors state very clearly that, listen, there is no communication, there is no system. We want to streamline our hygiene, but we have no clue how to do it because the members of our team are treating our patients differently. And in fact, we're providing services and we're not even billing for them. And we know this is a common problem. You can speak to any consultant, whether it's in Canada or the US, they all tell you the exact same thing. So a little story about my practice. When I bought my practice as a new grad, maybe about 2 years out, I had the same issues that many people have currently and did do when they buy a practice. We have the staff issues, where, here's this new guy who's coming in who wants to change things. We had production issues. Our hygiene was not even taking perio charts frequently. They weren't billing. They weren't even covering costs. We had no perio protocols. We got a lot of resistance from the existing patients because, here's this great looking Pakistani dentist, that would be myself, by the way, who says, we now need to treat you. So I call it the young dentist trying to pay off the debt syndrome, right? And of course, highly competitive. There's many dentists on every corner. So what did I do, right? And in addition, obviously, I had a high debt. So obviously needed to pay off student loans and then the loan that I took to buy the practice. So I decided, as many of you have, to hire a consultant. And I've spent thousands of dollars on consultings, and at the end of the day on consultants. And what I found was I got some great books that I never picked up or read again, and it led to no increase or no streamline in my perio program. So I then decided to spend over $150,000 on a marketing campaign. And so for those of you who are advertising, my hope for you is that you're spending those funds and tracking them, and that obviously involves your staff being trained. But what I quickly realized is that it wasn't working. Most of the production that we were getting was from referrals, not from these various forms of advertising. And I think we know today, now more than ever, that it's not about acquiring all these new patients. The customer acquisition cost is so high. It's really about keeping the ones that we have in our practice and providing them such a great service that they're going to generate more referrals. And right now, I can tell you, the demand that we have already in our existing practice, given our patients haven't been in our practices, for some of them haven't been in for over a year because of COVID. These are great patients to take them through because they need the treatments, right? They'll have bleeding gums. They haven't been in for a long time. So this is the opportunity to spend the time with your existing patients and offer these types of treatments to get them healthier. So of course, I did what most of us would do, because we think we know it all. Let's just try our own perio program. So we had a Cavitron. One of my hygienists loved the Oral-B, the other hygienist, loved a Sonicare, and because obviously, I didn't run my practice, my staff did. They got whatever they wanted. And of course, because we needed to treat the perio in our practice, all of my hygienist said we need more time, and as a result, we had to hire a second hygienist. So this is Gary, who received one of the first treatments. I call it the Dr. Sheikh perio program. And the perio chart on your left showing bleeding with 4mm pockets was before the treatment. And the perio chart on your right was after the treatment. Well, guess what? There was no reduction in bleeding. There was no reduction in pocket depths. So for those of you who are trying a quote unquote perio program and you're not seeing consistent results, you need to stop, because it's not a perio program. Right? So I later on learned about soft tissue management, and I decided, let's take the staff. It was a great course for the team, and there wasn't really anything offered at that time on perio. And we decided to implement, after taking the course, the full day course with my staff. I decided to implement the program in my practice, and what was amazing was the changes that we were able to see as a team, and I can't stress that enough. STM really is a team, and that's one of the reasons why the lecture or the full day course involves the team coming out and really being engaged in the process. So this is one of our first patients that we treated after taking the STM program. We had a great support from the company at the time, and of course now more than ever. And so this was Victoria. She presented with multiple sites of bleeding, deeper pockets. Her complaint was bleeding and sensitivity when brushing. And what was amazing is we told Victoria, listen, you know what? Your insurance is going to pay maybe $200 out of this $1,600 treatment. And she said, listen, I want to get this treated. Now, of course, you have to spend the time educating the patient. And this is what's great about the STM program. It's going to give you that time. So after we educated Victoria about her disease, allowed her to become involved in the decision-making process, we then were able to treat her. She wanted to move forward, which was great. We then decided to treat her in 4 visits. So this would be quad therapy with medications. We put her on medications at home, and I'll get to that. And this was her 4 to 6 week reevaluation. Amazing, right? Because we've now suppressed a lot of the bleeding points. Of course, perio treatment is not perfect. It's highly reliant on the patient. But what's great is this is the perio chart a year after. And of course, keeping her on a 3-month schedule, we're actually able to suppress the disease. Now, at that time, we didn't have lasers. We didn't have locally applied antibiotics. We didn't have a lot of the things that we do now. And I strongly feel like we can get her completely healthy. So what's great about this therapy, which we're going to talk about, is the patient is so much happier. Why? Because you've treated the disease. She's involved. She can come in and tell you, my 4mm pocket, how's my 4mm pocket? Is there bleeding back there? You know, plus she feels the difference. The front staff is happier because guess what? We now, instead of seeing this patient twice a year, which was the schedule she was going on before, we've now seen her for 4 appointments for quad therapy, and then a reevaluation, and then 2 additional appointments every 3 months, right? So that year we generated 7 appointments just from this one patient. Now the hygienist is happier. Clearly why? Because the patient is healthier. And that's exactly the reason why most of our hygienists would have gotten into this industry, is to get patients healthier. There's minimal bleeding, the patients are doing a great job, and they're invested in their oral health care. Now the dentist, of course, you're happier, right? Why wouldn't you be happier? More production, more appointments, busier schedule. But guess what? What's most important is now you've treated the foundation before you go do the crown, before you do the restorative. There's no bleeding. You've done what we were trained to do in dental school, which is treat the foundation first before we go and treat the teeth. And I think to me, that was the game changer. So in my practice in 2007, I implemented the Dr. Sheikh Perio program, and we saw very minimal gains with minimal results, quite frankly. So we stopped doing that. In 2012, we implemented the STM program about a third of the way throughout the year, and in that 1 year, it led to an increase in $300,000 in production, which was amazing. And that increase in production is what allowed us to grow and get more technology into practice. So STM is really about the 3 Ps. It's about the people. It's about the team. We cannot do what we do without the team, and we need to involve our team in making sure we have a cohesive system that everybody can follow so we can get the desired results. Of course, it's about patients. We want to make them satisfied. We want to give them good results, but we want to keep them loyal. And we want to make this a pain-free experience. It's funny, we were having a conversation with Lauren right before, and he said, you know, I can't tolerate the Cavitron on my teeth. And I'm thinking, we can help you with that by using piezo technology, which we'll get to in a second. So it's about keeping those patients comfortable, loyal, and as a result, they will refer. And I can tell you with certainty, I've seen it over the last 10 years with my own eyes. When you focus on what's best for your team, your people, and your patients, the profit will come on its own. You don't have to focus on it. You don't have to get a consultant to tell you this is exactly how you're going to make this and that. It will come on its own. So welcome to soft tissue management, otherwise known as STM. It is an organized system for early detection, diagnosing the disease, treatment options and treatment modalities, and then maintaining the patient, which is the most important thing. It involves a heavy component is on oral home care, and then it has an integral component of early detection of oral cancer as well, which I think is an important part of detection when we're doing our comprehensive oral examination. So why do we need soft tissue management? Well, I can tell you why. 3 out of 4 patients still have some form of perio. You know it. You're going to go to work tomorrow, and more than half of your patients are going to have 4 to 5mm pockets and bleeding. All right. And if you don't know that, ask your hygienist, and they can already tell you who's going to be coming in tomorrow who has that. So why do we need this now? Because patients haven't been coming in. Due to COVID, they've been hesitant. Now things are loosening up. Now you have all the proper PPE and the filtration systems, and you've got the HVAC test, and you got the barriers and the plexiglass. Now they're coming in, and guess what? They now have more bleeding than they did before, more plaque, because it's been a year. They haven't been looking after their oral health care. They've been more stressed. We're seeing all of these things. So what better time than now to present a treatment to your patient? Because they need it. So if you look at the percentage of services filed to dental insurance companies, the non-surgical perio services are minimal, which means that most dental offices are providing scaling and root planing, but they're not billing for it. Why? Because they're insurance driven. And that's one of the things that we really focus on in the program is how to talk about insurance, how to deal with it with your patient, and to try to get the focus on healthcare as opposed to what's covered by insurance. Now, I can tell you, we all know this. We're giving away a segment of our practice. As our overhead increases, the PPE costs alone, and now we're not billing for what we're doing in our hygiene department. I mean, it's absolutely insane. So we need to really drop the explorer, and we're all good at looking at open margins. Oh, we need to do some restorative, or there's some decay underneath the crown. But who's looking at the perio? So I encourage you all doctors, before you pick up the probe, before you pick up the explorer, pick up the probe, because I can tell you, STM can be very profitable for your patient, for your practice, and it's there. Your patients need it. So the key here is looking at the perio. We want to be able to check, the pocketing, the depths, the bleeding, and bring that to the patient's attention with your actual hygienist, right? The patient needs to be involved in the conversation, because I can tell you, quite frankly, most of our hygienists don't understand that whenever we open a flap, for example, a patient has recession. Oh, you know what, Dr. Sheikh, there's 1 or 2 millimeters of recession. I can tell you, having done periodontal surgeries for the last 10 years, there's always at least 4 to 5 millimeters of bone loss under there. So as a hygienist, we call them therapists. They are providing therapy to our patients so that they do not have to have these lovely surgical procedures like connective tissue grafting or pregingival grafting. So ask yourself, what are you doing with bleeding gums, 0 to 3 millimeter with pockets? You're going to say, well, Dr. Sheikh, it's just a little bit of bleeding. Well, Dr. Jones, if your eye was just a little bit of bleeding, would that be okay? Bleeding is not good in any orifice of the body or any extremity. So this is a problem that you have to recognize. This is early gingivitis, which can lead to periodontitis, right? 3 to 4 millimeter pockets, 5 millimeter pockets and above. So why are we bringing these patients in who haven't been in for over a year? Now we're seeing these patients, scaling them in 1 hour and telling them that they need to come back in 3 to 4 months. But guess what? They haven't been in for a year. You're cleaning, quote unquote, their teeth in 1 hour. So why would I come? I'll come back in a year. That's the message that we're giving our patients, right? That why would I come back in 3 to 4 months? So it's important to understand what we're telling our patients, because that's what our patients are hearing, okay? Now, periodontal disease, back in 1981, it was a national tragedy, okay? This article was published, 40 years ago. Perio was underdiagnosed, undertreated. 75 to 90% of the population has some form of perio. And guess what? Nothing has changed. In fact, now we've called it a syndrome. And this is an article about 30 years post that past article talking about how periodontitis is now a syndrome, which means running together with other systemic illnesses. And we know that the mouth is a gateway to the rest of the body. And I really encourage you to use that verbiage so that your patients can understand the importance of having good oral health care. We commonly have seen, and I know more than ever, have seen patients being diagnosed with diabetes, hypertension, on more medications. Those that weren't insulin dependent are now on insulin. So it's extremely important to understand that those patients with diabetes, for example, have up to 4 times the risk of alveolar bone loss than those that don't. So when are we telling our patients these things, right? They're just cleanings, right? No, they're not. You're providing therapy, you're removing bacteria in order to make the rest of their body healthier as well. So this is a great flyer from DenMat, and we use this on every one of our patients. We classify our patient into these different categories. So if they're early periodontitis, and then we focus in on the systemic illness that they have. So for most of them, they may have diabetes or heart disease, and how that links to what's going on in their mouth and vice versa. I think that's really critical to have your patients understand that so that they're buying in to the treatment that you're doing. This is not just cosmetic cleaning, okay? So Throughout the day and throughout the program, we talk about these things and we encourage all of our staff, including the dentist, to talk in those lines about the health concerns. The first step, of course, is we have to detect the disease. So our goal is to detect it and eliminate it before we start seeing bone loss or the bone loss gets worse. So you may look at this patient and say, wow, this is a perfectly healthy patient. But guess what? She's got bleeding. And this could be your first patient, your first STM patient who is bleeding in the posteriors, right? It doesn't have to be a train wreck with type 3, severe periodontitis. Now, the initiation and progression of perio is still the same. It relies on plaque, it relies on bacteria, and of course, most importantly, it relies on the inflammatory response of the host. And it's important to understand that some of these patients who come in, it doesn't matter what they do, they still need our help, right? Because of their host response to that inflammation, to that bacteria. Now, the ADA clinical guidelines still haven't changed as well. We still have to look at bleeding on program, clinical attachment levels and attachment loss, furcation and mobility are all key factors to assess a patient's periodontal status. And this is a textbook from 1997 talking about how, listen, the patient has increasing pockets over several perio charts that you take every 6 months or a year. They're at a higher risk for bone loss. If they have more pockets, if there's more bleeding, if they bleed repeatedly, so every time they come in, there's a bell going off telling you this patient is at risk for losing more attachment. And we need to treat them. We can't just keep seeing them, quote unquote, every 6 months or every 3 to 4 months. Now, in 2018, the American Academy of Periodontology came out with the new grading and staging system for patients. So we do discuss that throughout our, we will be implementing that in the STM program. So we talk about how to stage a patient and then how to grade them in different categories as far as grade A, B, and C. And that's an important part of detecting and diagnosing the patient. What other tools are necessary? Well, of course, you need to be able to see. So we always recommend loupes, and I know most dentists have loupes, but your hygienists have loupes. It's important for them to be able to see and also get accurate perio probing depths. DenMat has these great loupes. They're called perioptics. And for those who have a light, actually, I love the Firefly. I use it myself. It's a great light so that you can actually see what you're doing. But you have to start the patient dialogue. And where does this need to happen? You're thinking, well, Dr. Sheikh, we've got to talk to the patient when they're in the chair. Wrong. This has to be discussed when they first call the office. The front staff needs to advise the patient, listen, Mrs. Jones, it's been a year since you've come in. I understand that you'd like a cleaning, but it's been a year. We need to assess you. We will try to do your cleaning, but there's most probably you will have to come back, or we need to reserve some more time depending on what things look like. And I think that's reasonable for front staff to say. And guess what? By saying this, you've now opened up the avenue for your hygienist who tells the patient they can't complete them because they have perio. So it's something simple like that. And we talk about this throughout the program on what we need to do to educate our patients before they come in so that they're not expecting everything to be completed that day because it's been a year or 6 months. Now you have to take a proper history. So a lot of our patients are pre-appointed, or you can have these forms on your website so that the patients can fill them out. And then when they do come in, it's extremely important to talk them through the exam. So a lot of periodontal examinations are done behind the patient's back right now. Okay, we're not telling the patients, listen, Mrs. Jones, you're going to hear me say some numbers. 0 to 3 is normal. That's a healthy space around your gum. If you hear me say a number above that, then that means that there's bacteria or there's attachment loss, and that's not good. That can lead to bone loss and gum shrinking. If you hear me say bleeding, well, if your eye was bleeding, that would be a problem, right? And you get their acknowledgement, and now you've set them up so that when you're reading the measurements out loud, they can hear them. And this is one of the things that we go through, and we do actually role playing with throughout the program as well that day. Now, this applies to not only a new patient, okay? So this doesn't only apply to new patients, this also applies to existing patients. And for some reason, a lot of doctors are hesitant because they think, well, my existing patient's been in my practice for 10 years. What are they gonna say if I tell them that I need to treat this disease? Well, it's simple, things change. You haven't been in for a year. You've been more stressed due to COVID. You haven't been looking after your oral health care as good as you used to. And now's the time. Now we need to treat this. That's the verbiage that you need to use. So you also need to be able to print out a proper perio chart. So this is a perio chart. It's from AbleDent software. You put a color printer, you have some bleeding points, you can see it. Everything is very visual. If you really want to, you can smear a little bit of blood on the patient's, on this chart. You can put a little calculus on it, and you serve it to the patient, because guess what? This is their disease, and you are there as a professional to help them treat it. Now, you better have a solution, right? And that's what STM is going to do for you. So probing and charting is not an option when you're diagnosing disease. And this, for all of our STM patients, when we're presenting treatment, we need to have a proper perio chart in to be able to detect and diagnose, right? Another component is oral cancer and soft tissue management. So as we know, 1 American dies every hour from oral cancer. So it's very prevalent. And guess what? The stats are not getting any better. And in fact, the diagnosis and the screening is really our responsibility. In essence, screening for these patients, because we're looking in their mouths, 2, 3, 4 times a year, we really are the first line of defense. Now, guess what? April, a great month to start implementing this in your practice. If you're advertising, you can use this for your practice to offer maybe an oral lesion detection. But April is Oral Cancer Awareness Month. So what better time than now, than today, than tomorrow, right? To implement it. So it's critical to understand that early detection is important, because early detection can improve the survival rate for a patient. Late diagnosis leads to poor quality of life and oftentimes results in aggressive treatments. So there's many adjunctive tools that are used for other types of, cancers, right? Breast cancer, cervical cancer, prostate. Why not for oral cancer? So the conventional head and neck exam, I would hope that all of us are doing it. And I know most of us, sometimes just do it really quickly, but we need to spend the time and tell our patients that we're doing a lesion detection. Obviously, we can't look for oral cancer, because the only way to really tell if it is oral cancer is through a biopsy. But our goal when we're doing a head and neck exam is to do a comprehensive assessment of all the tissues to look for any lesions. Now, what helps, and what I love, and I use this in my own practice, my hygienists each have one of these in their ops, especially now because of COVID and sterilization and cross-contamination, is the Visalite Pro. And it's an amazing system or technology, and allows us to shine a light on the tissue. And then we also have a T-Blue system, which allows us to mark a lesion to really assess if there's an issue. So we use those two in conjunction together. So for example, your patient comes in, we then go ahead and we screen the patient. So as doctors, we need to do this. And you'll look for an apple green color, okay? And if there's anything abnormal, that will show up as a darker area, like a black area, and that's called loss of fluorescence. Now, what we like to do for all of our patients is we do this once a year. We charge them a flat fee, but we incorporate this into our comprehensive oral examination. I think it's critical to be able to have this as part of your screening and detection, okay? So now we get to treatment. So we've diagnosed, we've told the patient, listen, there's a problem here now. So remember, the pathogenesis of perio starts off with plaque, leads to gingivitis, turns subgingival, and then turns into periodontitis, which is bone loss. How do we know gingivitis is going to go to periodontitis? We don't. There's no bell that goes off. We don't know that, which is why we have to treat gingivitis. Okay, so that when disease is present, we need to provide therapy. So we're not just doing prophies here, people. We're providing therapy for patients who need it because there's bleeding and there's pockets. So are you performing periotherapy for preventative fees? Why are you doing that? Because you're insurance driven. And it's okay. Many people are. But that's what we review throughout the program, is how to use the verbiage, the terminology, and educate your patient so that they understand the importance. So hopefully after today, you'll stop billing prophies and start billing, root planing for those patients who are having that type of treatment. The programs are really simple. So if you have 0 to 3 with bleeding, you're a type 1. You're in a program 1. Typically, that therapy can be completed in 1 session, and then we do a reevaluation to see them back in 4 to 6 weeks to see if the therapy that we did and their oral hygiene is working. In the type 2 program, we complete this patient in 2 separate visits. So we do half the mouth in one session, half the mouth in another session, and then we do a reevaluation. And the last is a quad therapy, which is moderate periodontitis. We perform the therapy on those patients in quadrants and then do a reevaluation. So it's a total of 4 treatment appointments and 1 reevaluation. So what's great about the soft tissue management program is it's already done for you. It's classified, all the codes are already given to you. All you have to do is just make some beautiful folders and present these treatment plans to your patients. What's amazing is it gives you the time to connect with your patient. Every single therapy starts off with an initial diagnosis or a comprehensive oral examination where we're taking x-rays, we're doing our lesion detection, we're reviewing OHI, and by the way, this is all billable, okay? This is billable. Most 90% of your patients are due for this, and what's great is since COVID, all of my patients have been having comprehensive oral examinations. We've been bringing in all of our patients for an extra half hour, doing a COE, having the time to review any other concerns. There's no better time than now to get your patients in, because if you have openings in hygiene, book them another half hour, do a comprehensive oral examination, present them the treatments because you have more time. So take advantage of that. I can't stress that enough. You really can see about 5 patients all COEs versus a regular 8 patients a day. So it only makes sense, right? Less patients, more production, and better comprehensive care. So you classify them obviously in the class type 1 gingivitis case. There's the type 2, which typically oftentimes require, half mouth debridements, which is your type 2. And then these type 3, which are more moderate or advanced, depending on your comfort level, you would treat these in quadrants and then do a reevaluation, which by the way, periodontists are doing anyways before they do surgical procedures. Guess what? You're the first line. You can do this in your office. Now remember, here are some general fee ranges, but these do not include that initial comprehensive oral examination, or if it's a new patient exam with x-rays and oral hygiene instructions. So again, all of these codes are given to you. Okay, so here's an example of a patient who comes in who has moderate perio. You've determined, or your hygienist determined, they're a case type 2. Here's a treatment plan. It's done for you. This is what you're going to do therapy session 1. This is what you're going to do therapy session 2. And there's the reevaluation. Now, of course, we tell our patients, your insurance works great here. They're going to cover this amount. This is what you're out of pocket. I strongly encourage you all to listen to this statement right here. Insurance is a benefit. It is not a right. So call them benefits. Hey, Mrs. Jones, you have a benefit. The last patient who needed this treatment got nothing, received nothing. But don't you want to get healthier? Don't you want to see your oral health improve so that your systemic, your body will improve as well? So here's a classic example of a case, generally posterior areas have bleeding with 4mm pockets. Now we've treated them. So we treated this patient in 2 visits. We did half the mouth in one session, half the mouth in another session, and then a reevaluation. And there's a reevaluation right there to your right. How amazing is that? That's a treatment that you can provide and get consistently with this program. Now, where do we go from here? We talked to John about maybe removing the wisdom teeth because that's where the bleeding is. So do you see how we're taking the patient through a treatment to get them healthier, because bleeding is not good, pockets are not good. Remember, STM is not a deep cleaning. We're not treating rugs and carpets here, folks. We're treating patients. Nobody wants a deep cleaning. That just sounds like it's going to hurt. STM is a medicated cleaning, and it treats the disease. And that's the verbiage that we encourage doctors to use. Now, of course, when we're treating them, we need to treat them to the highest level. We need to make sure it's comfortable, it's not sensitive, we're not drowning the patient. So when we treat them, we're removing biofilm. We all know biofilm, it's very complex, and for some patients, it can be very tenacious. So scaling and root planing is still the cornerstone. Of course, we want to remove the biofilm, we want to initiate healing, and we don't want to damage the root. Of course, you have to use sharp instruments. I can't stress that enough, especially for those offices that are using a little bit more hand scaling. Make sure you have sharp instruments. So there's 3 different technologies out there. There's the orbital, the elliptical, and then the linear. Many of you have a Cavitron, which is magnetostrictive, and what that does is it hits the tooth kind of in an elliptical fashion, which generally causes a lot of sensitivity on patients. The beauty of a linear technology, which is piezo, is that it rubs the tooth and it doesn't hit the tooth. As a result, it's much more comfortable. Now, there was an RDH article that came out talking about the difference between Cavitron and piezo, and really there's not much comparison. It's like using a chisel to remove bone around a wisdom tooth when I can just pick up a high-speed surgical handpiece. It's the way of the future, which by the way was 10 years ago. It's more efficient and patients prefer the piezo. I, just like Lauren, cannot have my teeth scaled with the Cavitron. I will literally jump through the roof. When my hygienist uses piezo, I barely feel anything, okay? So what DenMat has is called the ProSelect Platinum. It is the only system out there on the market right now that has a 3-bottle system. You've got distilled water, which by the way you can heat. You've got your chlorhexidine, which is your antimicrobial, and then you've got fluoride, which can help to desensitize. So that's really what STM is. It's ultrasonics with medicaments and heated subgingival irrigation, which by the way, all of these services are billable procedures that are built into the STM codes. So what would you rather have, a Cavitron or a piezo? And the benefit of the piezo is simple. You can see, because guess what? It has a light. And just like our handpieces have lights, wouldn't it be nice for our hygienists to be able to see what they're doing? You're generating less heat because these are titanium tips, which means ultimately you're using less water. You don't need to drown the patient like you do with Cavitron, which by the way, Cavitrons typically are hooked up to outside water sources, which are not hygienic. Also in Canada, it gets frickin' cold over here. So the patients are, you're putting cold water and it's just a nightmare, guys. So you got less heat generation, improved patient comfort. The hygienist doesn't have to put as much pressure with the piezo, and it's much faster. These operate at about 40 to 45,000 cycles per second compared to a Cavitron, which is slower. So technology is critical, just like when you're doing any other procedure, to try to improve your efficiency and patient comfort, and that's why we use the piezo with the STM program. Now, of course, there's other adjuncts to be able to get our patients healthier to treat the disease. We've got our scaling and root planing, right? Where we're gonna use our piezo and medicaments, and we go through that during the program. We have locally applied antibiotics, depending on if there's some persistent sites. Typically, I would use these at the reevaluation stage. And then there's some patients where we just put them on these perio trays. So what's great is, it's been shown that 1.7% hydrogen peroxide gel can break down cell walls, a typical dental biofilm, and that can keep the bacteria at bay. So we use a perio restore kit, which basically our patients are placed on. They're customized for the patient, and they force the gel into interproximally and intracellularly, and that allows the bacterial load to be minimal, thereby reducing the amount of biofilm, okay? So another adjunct is laser therapy, and I love lasers. I typically talk during the course about the soft tissue diode laser, which targets everything we want in granulation tissue, which is melanin, hemoglobin, water, and pigmentation. The advantages, of course, of using lasers is that you don't get bleeding, there's no recession, and it's very easy to use. My hygienists use it. I use them on a daily basis. And there's so many procedures that you can use other than for soft tissue management. So here are just a few that I use in my own practice: troughing, gingivectomies, frenectomies. I love using them around implants as well. And then, of course, our hygienists use them for what's called LBR, which we talk a little bit more in depth about during the course, but also for desensitization and aphthous ulcers. So the way we use it in particular with STM is typically our hygienist would use a non-initiated tip, go intracellular and fire the energy. That actually helps to reduce the bacterial load before you scale and root plane. Now you go ahead and use a piezo, which is warm water, ultrasonic linear motion, which is comfortable for the patient, and scale and root plane. And at the end, I would come in and initiate the laser, and I'll remove the granulation tissue. So it's a three-step, really it's actually a three-step approach to be able to help reduce these deep pockets. We get amazing results. So DenMat offers, they have the sole which is their wired version, but I'm a huge fan of the NV Pro. I think every office should have it. It's wireless, very easy to use, and I highly recommend this laser. So this is an example of an STM laser therapy. We did not use any locally applied antibiotics, but this is the before on the left. We did quad therapy with laser treatment, and we were able to get the patient down to just a few sites of bleeding points. And at that point, we were able to use Atrodox or a locally applied antibiotic to be able to help resolve those areas. And again, we talked to this patient about wisdom tooth removal. So the production that you can get from lasers are just insane. I mean, the amount of frenectomies you can do. Many of you may have already a laser and just not using it, which is a total shame. So the goal is here to reinvigorate you, your passion in providing the best in quality care to your patients. Save them, a recession, do a frenectomy, treat an aphthous ulcer. And the hygienist can do a lot of these aphthous ulcer and desensitization treatments as well. So the production alone, let alone the benefits to your patient, are just huge. So once we treat the patients, the next step is really prevention, right? We don't want them to go regress. Prevention is obviously the right thing for our patients because it helps to keep them healthy and it prevents secondary decay. In kids, I think we've all seen a rise in dental caries amongst kids, and our goal is we would love to be able to prevent those somehow. Same thing in adults. Caries is still the most common dental disease, and that disease increases with age. And you have the elderly patients which just don't have the manual dexterity to be able to keep their teeth clean. So we strongly believe in fluoride and implementing a fluoride in as part of the STM program. Fluoridex has been something on the market for many years. I've been using it in my practice for those patients who just have continued sensitivity. And some of these patients were even placing them after a therapy. So we put them on Fluoridex post-STM therapy just to help maintain or desensitize them. So this is a 1.1% neutral sodium fluoride, but they have different versions as well. And now the most important part of any good perio program, listen, I don't care how good you are. I don't care if you're the best scaler in the world with the best medicaments and the best techniques. If your patient isn't doing what they need to do at home, your perio program ain't gonna be much of a perio program, my friend. So we need to implement some type of home care. And right now, this is what our patients are seeing. They're seeing all this crap and they have no clue what to buy, but everything here is telling them that they don't need us. So the role of the patient is super important. If we don't get the patient involved, if you're telling the patient that 90% of what this is gonna happen, how this is gonna work is on the dental office, then you're setting them up the wrong way. If they're not invested in any type of therapy that you're providing, you're gonna have failure, okay? So if 75% of these patients have perio, why are most of them just brushing their teeth with a regular toothbrush? Why are they not flossing? They don't like to floss. And 2 to 20% of the population floss their teeth. Well, I can tell you, they're on this call right now. Those are the people who floss, the 800, 900 people who are listening right now. So as dentists, we bring in our patient, we, imagine this, your patient comes in, nobody greets them at the front. They come into your operatory. The hygienist begins to tell them how much they suck, how much they don't floss. Then, you go ahead and you give them 9 different things which they're never going to use. And by the way, they still have what you gave them the last time. And now they come outside and you ask them, when would you like to come back? What kind of experience is that for your patient, right? That needs to change. Really, we need to look at change. So enter the Rotodent. This is the oral home care device that we use for the STM program. It's amazing in the sense that it looks very similar to a Profi head. It's very small. It can access all areas of the mouth very easily by patients at home. But what's great is these microfilaments. They're about 1/3 the width of traditional bristles, and they can actually get interproximal and even subgingival. Now remember, even flossing can't access the mesial concavity of premolars. You just can't. And this is why patients still need to come and see us. So look for yourself. Oral-B, Sonicare, regular brush. Look at what can access the linguals of the lower anteriors better than a Rotodent. Nothing. So it's great to give for patients that have difficult access issues around crown and bridge, around ortho. And there was a clinical study already done. Over 230 patients showed very clearly that with a Rotodent, we were getting better hygiene levels and better compliance. Why do you think they were more compliant? because you weren't telling them they sucked every time they came in, and you weren't giving them 9 different things to use, which they can't use. This is one tool, one instrument that they're using because we know that they're not going to floss. Now, don't get me wrong, flossing is a gold standard, but if it ain't working, we got to change what we're doing. So what's great, just like, wisdom tooth extraction, is you have your home care instructions, right? Your oral hygiene instructions for the program. So it tells the patient, this is what you do in the morning, this is what you do at night, and after the reevaluation, moving forward, this is what you're going to do, and we'll see you back in 3 months. It's very, very simple to implement. But some of you are thinking, I don't need this. I'm treating my patients. I'm seeing them every 3 to 4 months. But is there still bleeding? Is there still pocketing? Are you waiting for things to get worse before you really treat them? So it's about how we talk to our patients, right? And we can't have verbal skills like our good friend Simon here. We need to be able to talk to our patients in a way where it's not confrontational, where it makes a good experience, but we're still getting our point across. So listen for the hot buttons. If a patient's worried that their gum is shrinking, then talk about their gum shrinking. If they don't do this procedure, their gums are going to shrink more. Or maybe it's about losing teeth. Oh, I lost a tooth on the left side. Well, listen, if we don't treat your perio, you're going to lose teeth on the left side too. Or guess what? You think it costs more now? Well, the gum grafting that you're going to need in about 3 years is going to cost a hell of a lot more. This is non-surgical. This is a minimal cost to avoid more pain, to avoid more expense, and it's for your health. So as a summary, we made, this is like a nice quick start guide. IKEA has something very similar, in their toolbox of, building cabinets, I guess you could say. So these are the requirements. These are the required things that you need to perform STM in your office. You need some good blueprints which are provided to you by DenMat once you register with the program. The codes and the manual, everything is given to you. It's really easy. We need to have a morning team huddle. We need to be able to discuss which patients are coming in and which ones we're going to present so that we can be prepared, right? You're not going to go climb Mount Everest in shorts. You're going to pack snow pants, you're going to have water, you're going to have everything that you need. It's the same way you present any case to a patient. You need to be prepared. You need to have a piezo. You want to have a rotodent to be able to dispense to your patient along with medicaments, preferably in office, because we all know if you tell your patient to go pick something up from the pharmacy, the chances are it's not going to happen. And you need to be able to provide a nice perio chart to be able to explain to your patient. Now, these are recommended things like, an intraoral camera, consultation room, but these are, a soft tissue laser. Again, if I was performing any type of treatment modality, I'd want to be able to have everything accessible to me that I need. So let's get started, right? First step, when you call that patient or your front staff calls a patient and they're overdue, you need more time. Mrs. Jones, it's been 6 months, it's been a year. We'll try to do what we can, but listen, if you don't clean your house for a year, is it going to be more dirty? Probably. So we need to assess you and we will try our best, but we can't guarantee that things will be completed. And maybe book them a little bit longer, right? Do a comprehensive oral exam. This is a perfect time. COVID is an opportunity for you to be able to spend more time with your patients and present and perform these types of treatments. Less patients, more production. That's what it's about right now. So step 1, have a morning huddle. Pick 2 patients. Step 2, you already know which patients. You now have these case presentation folders ready. Your patient comes in, performs the exam, calls the bleeding points out loud. The dentist, your job, simple. Keep it simple. Don't say a lot. Just agree because you believe in what your team says and the quality of care they're providing. And you just listen to the patient and advise, yes, we would like you to move forward with this treatment. We want you to get healthier. So now your front staff presents the treatment and manages the questions that you already know are coming up. You already have an insurance breakdown. You should already know the cost, and the appointment availability should all be ready. So these things we focus on, they should be prepared in advance. We talk about this throughout the day as well in the program. You then have a case acceptance form where they then get the rotodent so they can charge it before the first treatment appointment, and they get a folder. Now, if they decline, we have an STM refusal form, and this is a legal binding form that shows that you presented them periodontal therapy, and they've declined. They're okay with their bone loss and their gum disease, right? So the first appointment, the patient brings in the rotodent charged. You review the treatment. Depending on which If it's an STM 1, 2, or 3, depending on where they fall, you would treat the patient. And this is an example of the sheet that is given to you. So this is what the patient would get, saying, Mrs. Jones, you're going to be getting all this in your therapy session 1, all this in your therapy session 2, and then there's the reevaluation about 4 to 6 weeks later, so we can see if what we did and what you're doing actually worked. And then you've got the fees, and they're out of pocket. Okay. You then perform the treatment, review the post-op instructions like any other treatment, and then you book the subsequent appointments as well. When you perform the reevaluation, you always want to make sure that you show the patient the results. And if you select the right patient who's invested in the care and you perform the treatment, which is very easy, all your hygienists are more than capable of doing this, you will see results. You will. Okay. Now you congratulate the patient, and remember, the patient, depending on their compliance, they may need retreatment. Okay, nothing lasts forever. If they decide to stop brushing for, another 6 months, this disease is going to come back, just like if they stop taking, blood pressure medication. So what's great about DenMat is they have a level 2 program, which actually they have somebody come into your practice, and hopefully that'll be starting back up soon, to help you implement this solution when in your practice, because implementation is always the tougher part, and every practice has its own nuance. So this is my team, and I could not do what I do without them. This is the change in my production since I implemented STM in 2008, and the production just keeps going up. The national average for hygiene is very low. In fact, in some area in Ontario, it's less than $90 an hour, but with STM, we've got it up and around the $200 to $300 range. So remember, we talk about the 5 pillars, which we discussed kind of briefly today, and it really is using a team approach, using the front and back office, and that's really what it is, a true system to be able to get your patients on board with perio. So I'm excited for you guys, hopefully, to start implementing a great perio program such as STM, and you will see success, and I'm excited for that.